speakers for the next session. So before that, we will move on the debate for the debate. So for the debate, I will invite our balanced view, Dr. Srinivasan sir. So are we all ready for the debate? A very interesting one.
So as we move on to the next session, the session will be on debate. It is going to be app-based weight loss program in diabetes care. May I request Dr. Venkatesh, Dr. Prem Kumar, Dr. Srinivasan to the session, please.
Dr. Balamurugan and Dr. Rajendran for inviting me for this session and making me a treasurer for TRAC 2025. So we'll move on to the session as a lack of time. What it is we have diabetes in an epidemic proportion in India, and this is because of our lifestyle. So whenever you ask a patient whether they go for a walk or do physical activity or control their diet, they say there is no time, they can't concentrate, things like that. Everyone has smartphones now, and whether it can be used for a useful way to change lifestyle, or instead of having Instagram or Facebook, YouTube. Other than that, can we have it for a useful way to change lifestyle is the question. And we have an interesting debate where Dr. Venkatesh is going to say there is hope in using the app for weight reduction, and followed by which Dr. Prem Kumar is going to say that it is a hype, and I'm going to have a neutral view on it. Thank you. Over to Venkatesh, please.
Thank you, sir. A very good morning, everyone. I welcome you all for this scientific debate discussion. At the outset, I would like to thank Dr. Balamurugan sir and the scientific committee of RSSDI for giving me this wonderful opportunity. So today's debate is, as what the moderator has said, that is the app-based weight management. Is it really useful, or it's a humbug, or it's a that's a hope or a hype? I am on the side of hope. It's a app-based weight management. It is really useful for us. So I am in the next 10 to 15 minutes, I am going to narrate the salient points of the mobile app features. This is my agenda. Before my presentation, I also thank my competitor, Dr. Prem Kumar sir, for sharing his slides. He only prepared both hope as well as the hype slides. Thank you, sir. And also my special thanks to our moderator, Dr. Srinivasan sir. Why I am mentioning special thanks means we all will know at the end of my presentation. Okay. Today's agenda is the rising obesity epidemic globally. We are going to see about that, and traditional weight loss program often fail long term. That is the even though the traditional weight loss programs are many suggestions are there, still we are not able to achieve the weight loss, a significant weight loss. And also apps, the healthcare apps as a new tool for the weight management. Is there any evidences regarding these apps are helpful in the weight reduction? Yes, there are evidences. We are going to see in the further slides. So obesity, we all know that obesity, the prevalence and incidence of obesity is rising globally. Even the childhood obesity, everything is a significant public health concern nowadays, and also it causes multiple health hazards to the person, and also causing multiple significant cardiovascular morbidities and mortalities, cancers, and every metabolic changes may because of the obesity. So we have to tackle the obesity to prevent the complications. So coming to the statistics, India has the third largest population with the obese people, next to US and China. And according to the recent ICMR data, around 25 crore people of adult population in our country is having the generalized obesity, and also around 35 crores of people having abdominal obesity, more prevalent in the women's. So the prevalence of obesity is around 24% among the women and around 23% among men, but the abdominal obesity is more prevalent in the women also. So for reducing the abdominal obesity, definitely physical activity is a main cornerstone in the management. Diet as well as the physical activity is the main cornerstone in the management of controlling the central obesity. So childhood obesity, approximately 12.5 million children in our country were obese by 2022, which shows a dramatic increases in the numbers compared to the past decade. So for a successful weight loss program, we need a fundamentals of nutrition or a medical nutrition, guided medical nutrition therapy, and exercise and physical activity which also needs guidance, and self-monitoring, which is very, very important, self-monitoring and assessment, which is very important in the weight management, and also the weight maintenance. Why? Because means reducing weight but not able to maintain the weight. That is the main problem in most of the people. So weight maintenance, that is the preventing the relapse, that is also very important. So for the successful weight loss, we need these components which must be needed. So for a weight reduction, many of our patients says that I am going for a regular walk for a 30 to 45 minutes but still not able to reduce the weight like that. But for a successful weight reduction, one may need a high intensity comprehensive lifestyle intervention, which is very much needed. It is an high intensity exercises are needed, but for the diabetic patient needs a professional guidance is must for that, whether the patient is able to do the high intensity exercises or a patient can do like that. Professional guidance is very much important. So professional guidance along with that high intensity with multiple visits, patient may lose a weight up to 8% over a period of 6 months. With a proper guided therapy, patient may have a weight loss of up to 8%. We can over a period of 6 months therapy. And behavioral therapy, it is one of the very good supportive tool in the management of healthcare, not only obesity. In the management of the healthcare, it is one of the very important tool. Why? Because means behavioral therapy is we have to need to modify ourselves. That is that we need to look on all the things, diet recall, everything, reminders, everything we have to look on that for the successful weight reduction program. So coming to the components of the behavioral therapy, cognitive behavioral therapy and self-monitoring of food intake, physical activity and weight, stimulus control, slow eating. These are all the some of the changes we have to do for the very significant weight reduction. And goal setting, that is the realistic goal setting. So just we want to reduce 10 kg in 6 months like that. We have to from the baseline 3 to 2% for 3 months, and next 3% for next 3 months like that from the baseline. That is the realistic goal setting. They are all very, very useful in the management of the obesity. And problem solving instruction and social support. But these all components can be taken care by the health apps. They will take care of these components like social support and goal setting and self-monitoring of our food intake, physical activity and weight, everything. They will make statistical and show us data to us, and the behavioral support by the app is enormous, and we can utilize that. Thereby we can make a weight loss program a successful one. So for the proper weight loss, definitely in the diabetic patient as well as the non-diabetic patient, definitely it's a team approach only, team care, multidisciplinary care is very important by the physician, psychologist, nutritionist, trainers, nursing practitioners, educators and surgeon and anesthetist if they go undergo the bariatric surgeries. So multidisciplinary team, but it's a collective approach and collective approach. But in reality, whether it is possible means nowadays it is possible, but still there is a lag in that. there is a shortage of the specialist. So though the doctors ratio is increasing, but still the consultants and specialist ratio is still not able to meet our growing demands. And also the paramedical professional support is also lagging in this kind of management. And all the overcrowded OPs, which leads to we can't able to allot a quality time for the patients because of its overcrowding of the OPs, which leads to we only able to make it out the salient points like that only. We can't able to do much better consultations due to lack of time. So these are all some of the pitfalls in our physicians side as well as the paramedic side. So even though to get rid of these pitfalls, nowadays the many specialized clinics are arising. That is the obesity clinic, cosmetic clinic, diabetic clinic. Everything is arising, but by recruiting all these paramedics, which leads to increased expense of this, which can't be afforded by many of our population. So definitely, though the specialty clinics are there, but in a small number only, but can't be afforded by all of the people. So is there any cost effective management in the weight reduction? Is there? Means definitely yes. It's a mobile digital media is one of the mass communication media. It is one of the easy way of creating awareness over the health. So nowadays everything app based or everything the digital based is the main criteria nowadays. We are changing towards digitally only. And also in our country there is around 70% are having the mobile phones, and the internet usage is around 60%, and also social media usage is also around 60%. And the smartphone users also more than 50% in our country are using the smartphones. Definitely by these health apps we can able to change the with some risk also there, that he will discuss about that. And 60% of the smartphone users seeks health information through the online, and also 30% of the social media persons follows the fitness and weight loss influencers. So with proper guidance, with professional guidance, definitely we will able to make it out. So weight loss management apps can be useful, but their effectiveness varies. It shows aid in weight loss and improves the health behaviors, but having some limited or no significant impact. It depends on the individual engagements, app features, and the user's commitment to the programs. So what are the benefits of these health apps? It creates awareness, definitely we all agree with that, and improves the adherence, that is the features like self-monitoring, reminders, and social support, which enhances the adherence to the diet and exercise plans. Accessibility and convenience. The apps are readily available. It is easy to access and convenient for many of us. And personalization, some personalized meal plans, exercise routines, and feedback, which leads to a better outcome of the persons. And effectiveness, evidence-based. There are many studies we all will see later. Coming to though it is a much benefits, definitely it is having certain limitations. Engagement adherence is crucial, and some individuals may struggle to maintain the consistent. We all see in our mobiles we are having multiple apps, but we don't use much of the apps. We download that, but consistency of usage of app is somewhat is the main point in the success of this kind of apps. Effectiveness varies, and limited only short-term data are available, long-term results are not available. It is definitely not a replacement of a professional guidelines. Okay, that's all. So these are all some of the apps. That's final sentence. So these are some of the apps which has been used globally by well-known apps. Coming to the evidences, its recent studies shows that app-based interventions can be effective for the modest weight loss, 2 to 5% of the body weight over 6 months. Apps are more effective when paired with the behavioral therapy and professional support. That is more effective when paired with the behavioral therapy and professional support. Long-term adherence and the user engagements are the critical for the success.